What if I told you your body has a healing system more powerful than any surgery, than any medication, than any other treatment option? Maybe you've been dealing with chronic pain from arthritis or an injury, a torn ligament or tendon, and you've been told that cortisone injections or pain medications or even surgery is your only option. It's not your only option. A few years ago, I had a torn labrum in my shoulder. I went through a steroid injection. I went through months and months, 6 months of physical therapy, and really nothing worked. And so when I went back to my orthopedist, he said, you know what, it looks like surgery really is the only option here to fix this. I really did not like that. And so I started looking into other options. Stem cell injection into my shoulder is what I ended up doing. And I'm so glad that I did because I avoided surgery and my shoulder's back to 95% better. I can do anything I want with a shoulder now. What I discovered really has changed everything for me, both in what I can do now, exercise-wise, fun-wise. I can go rock climbing again with my husband and my kids, but also in terms of how I treat my patients. So instead of referring to the orthopedic surgeon right away when somebody has a torn labrum or a torn rotator cuff or labrum in the hip or arthritis in the knee or the hip or the shoulder, instead of referring to orthopedists right away, now I have an option that I can give them that heals the problem instead of requiring cortisone injections or surgery or chronic pain medications. I used to treat these chronic pain patients and prescribe all these medications, opioids, all the time. Now I have a better option. It excites me so much that I can be part of the solution that helps patients avoid unnecessary surgeries and getting them back to feeling pain-free, functional, and living their lives again without pain. Our body has a built-in system that heals itself. But when an injury has been going on for too long or it's too severe, that system kind of gets stalled out or overwhelmed by too much inflammation. And this is where regenerative medicine really can come in handy, especially hand in hand with functional medicine, where we really do everything underlying to make sure that the body is ready to heal. And then we can inject stem cells, PRP, into the area or even IV and have the body's own healing mechanisms kickstarted again so that tissue is repairing and regenerating while you're going about your day, while you're sleeping. Some people have mistakenly understood stem cell therapy to mean that we're injecting somebody else's stem cells into your body, and those cells are going to replicate and turn into your cartilage cells or your vascular cells, whatever they are. That's actually not the case. The way that these injections work, these regenerative injections work, is by there's signaling molecules. So we inject Wharton's jelly, we inject exosomes, we can inject PRP, we can even inject peptides. And these are signaling molecules to signal your body, decrease the inflammation, turn up the right kind of healing inflammation. Let's also then signal the body to gather our own stem cells, produce more stem cells, and send them to the area where their injury is or where the inflammation is and regenerate that tissue. Remember, our body has its own healing system in place where we were created that way. So we want to wake up our body's own healing system again. Now, the Wharton's jelly also includes basically the scaffolding or the Lego blocks for building new tissue. So along with the signaling, we have these building blocks, these proteins, the scaffolding, these growth factors that are just the perfect mix for making sure that the body regenerates its own tissue and just heals on its own. With blood transfusions or stem cell transplants that we use in cancer treatment sometimes, the risk of rejection is often a concern for patients. And the way I explain it is like this. We're taking cells from an umbilical cord of a baby that's born and goes home with their mom and dad, hopefully. And we're using those cells. Those cells are actually immune privileged. Otherwise, the mom's body would reject the baby's tissue. It's a different tissue. So that same biological principle applies when we inject Wharton's jelly or amniotic fluid purified or these exosomes into somebody else. We do not need to do a blood type. We don't need to cross match. We don't need to verify Rh factor like we would if we were doing like a blood transfusion, for example. So we don't worry. We don't have to worry about rejection, about a reaction when you're getting these stem cells injected. It doesn't happen. The cells are immune privileged. This may sound like science fiction. It's not. If you grew up in the 80s like I did, this might sound like science fiction, but really we're just harnessing what the body already is created to do and knows how to do and just redirecting a little bit. It got off track when the injury happened, when the inflammation kept being present, and we're just redirecting and allowing the body to heal itself like it should. Just giving it a little extra boost. Now, healing takes time. And so, with regenerative injections, usually I like to prepare my patients for what to expect. And usually the timeline looks something like this. During the first few weeks, the pain drastically decreases because we've decreased that inflammation so much with the Wharton's jelly or the exosomes or amniotic fluid, whatever we're injecting with, whatever the situation warrants. But then after that, those cells really get to work and that tissue is rebuilt and regenerated over about the course of 6 to 12 months. So this stuff keeps working in your body for 6 to 12 months, rebuilding, regenerating, repairing the damaged tissues. And so while many of my patients, probably even most of my patients, see results for sure within the first 2 to 3 months, those results continue to improve over the course of up to a year. So it doesn't take 6 to 12 months to notice an improvement, but these cells are continuing to work in your body for 6 to 12 months. For me, the timeline was somewhat similar when I got the injection into my shoulder. I spent a lot of money on it. I knew in my heart that it would work. And I also knew in my heart that I was not going to get surgery. And so I kept a very close track of that shoulder. I babied it for a few weeks like I was supposed to. I didn't do any lifting. I really was good about my diet and doing very gentle stretches, no icing it, no alcohol, really very little sugar. I didn't take any anti-inflammatories for any pain that I had, and I really didn't need to actually at that point anyway. But for the first 2 to 3 weeks, the pain was decreased. I had a little bit of an increase in pain then as I started to do things again, but I had to let that pain guide me. Anything that I did that caused bad pain again, I backed off of a little bit because I knew I didn't want to cause damage to the tissues that I had just invested so much in and wanted to repair. But over time, I can listen to my body and allowed my body to kind of tell me, okay, how much can I do today? How much can I do in this workout? Is that particular, exercise or lift a good idea for me right now? If it's not a good idea for me right now, maybe I can do it in a few weeks. And that's kind of how I progressed. And eventually I went into physical therapy again with the idea of stretching the muscles around and really focusing on strengthening the shoulder muscles around because at some point my labrum tore because of something I was doing. And so I wanted to make sure that I was decreasing the risk of this happening again. So I worked with a physical therapist again. And now that the tissues were healed or healing, I had so much more success with physical therapy and I am 95% better now. I can do just about anything I want. I can do push-ups, I can do overhead presses, I can do just about anything I want. I want to give you some hope here. If you've been told that surgery is your only option, just know that that may not be true. In order to find out what your options are, I would be happy to have a quick conversation with you, kind of a discovery call of sorts to figure out, is this an option for you? And what can we do? And what might the plan be for fixing your shoulder or your knee or your hip or whatever the case may be for you. I'm having a free webinar to kind of do a little bit more in-depth teaching on this and to show people, okay, what is this? How does this work? We're doing this on September 19th at 12 Central, so noon Central. And you need to register below to make sure you get the link. But I hope you'll join me there, especially if you're considering this or confused about this, or if you have a family member or friend who may be in need of this. So you can kind of help me spread the word too, so we can help more people. The webinar is entitled, How Your Body Can Heal Itself When You Give It the Right Tools. So please join me for this webinar, September 19th, noon Central. You can sign up below.